Welcome to Study Nurse IQ. I'm Ginny. Today we're diving into blood transfusion. What is a blood transfusion? A blood transfusion is when we give a patient new blood, most commonly red blood cells, through an IV. We do this when a patient's red blood cell count is too low. Why might someone need this? 1. Blood loss from surgery or trauma. 2. Anemia, a condition where the body doesn't produce enough red blood cells. This can happen with diseases like renal failure or cancer. The importance of red blood cells. Why are red blood cells so crucial? They're essential for our survival. With the help of hemoglobin, red blood cells carry oxygen from the lungs to the rest of the body. They also pick up carbon dioxide, CO2, from our body tissues and take it back to the lungs to be exhaled. When a patient is low on red blood cells, they'll show some key symptoms. 1. Pallor. They may look very pale. You'll see their skin color improve after a transfusion. It's amazing. Fatigue and shortness of breath. Any activity can be exhausting. 3. Increased heart rate, tachycardia. To make up for low oxygen levels, the heart works harder and pumps faster. This results in an increased heart rate. So, when do we transfuse blood? It depends on the patient's overall condition and vital signs. According to current guidelines, transfusions are often recommended when a patient's hemoglobin levels drops to around 7 to 8 grams per deciliter. Normal hemoglobin levels: males 14 to 18 gross, females 12 to 16 growlers. The nurse's role: prep work. Before even a single drop of blood is transfused, the nurse's role is critical. Proper preparation prevents dangerous transfusion reactions, and hospitals have strict protocols you must follow. The first step is a type and cross-match. A sample of the patient's blood is drawn and sent to the blood bank. This is a critical step. Make sure you double-check everything, from patient identification to the blood band. Clerical errors are the most common cause of transfusion reactions. Next, you must verify blood. Compatibility. Do you know the universal donor and recipient? Universal donor, O negative, can donate to all blood types. Universal recipient, AB positive, can receive blood from all types. Informed consent. Before beginning, always obtain informed consent. Explain the procedure to the patient in simple terms, confirm their understanding, and ask about any past transfusions or allergies. NCLEX alert. Patients who've had many transfusions are at risk for a febrile non-hemolytic reaction. They may need to be pre-medicated with acetaminophen, Tylenol, or diphenhydramine, Benadryl, about 30 minutes before the transfusion starts. Next, we assess patient health. Before starting the transfusion, ask yourself, is the patient at risk for circulatory overload? Patients with heart failure or renal failure can't handle extra fluid volume well. A doctor may order a diuretic like Lasix to be given before, during, or after the transfusion. Next, ensure you have reliable IV access. Blood transfusions require a good IV access, typically an 18-gauge or larger catheter. A smaller gauge can cause red blood cells to break open or hemolyze. Study tip: since a unit of blood takes 2 to 4 hours to infuse, consider a second IV site if the patient needs other IV meds. You can't give anything else through the blood transfusion line. Gather supplies. Before starting the transfusion, make sure you have the right equipment. You'll need special Y tubing with an inline filter. You also need a bag of 0.9% normal saline. NCLEX alert. Saline is the only solution you can ever use with a blood transfusion. Other solutions, like those containing dextrose, can cause the red blood cells to clump. A simple way to remember this is with the mnemonic: red for risk, blue for drugs. Remember, only saline. When you're done, always dispose of all blood products in a red biohazard bag. The transfusion process. The blood bank will notify you when the blood is ready. Remember these key rules. Give 1 unit at a time. Start the transfusion within 20 to 30 minutes of receiving the blood from the blood bank. Infuse the entire unit within 4 hours to prevent bacterial growth. Verification process. This is one of the most critical safety checks. 2 nurses must verify everything together at the patient's bedside before the transfusion begins. What do you check? The physician's order. Patient ID matches the blood bank info and wristband. Blood type and Rh factor. Expiration date. Blood bag, check for clots, leaks, or damage. Kindly note, if anything doesn't match exactly, do not proceed. Send the blood back immediately. Next is vital signs and patient education. Before starting, obtain a full set of baseline vital signs: temperature, blood pressure, heart rate, and respiratory rate. NCLEX tip: if the patient's temperature is greater than 100 degrees Fahrenheit, notify the provider before beginning the transfusion. Next, explain the procedure to the patient and teach them to watch for early warning signs of a reaction: chills, sweating, chest or back pain, itching or rash, shortness of breath, nausea. Starting the transfusion. Always begin slowly, about 2 milliliters per minute for the first 15 minutes. Why? To minimize the amount of blood given if a reaction occurs. NCLEX alert: most transfusion reactions happen within the first 15 minutes. Stay at the patient's bedside and monitor them closely during this time. After 15 minutes, if the patient is stable, you can increase the rate to ensure the unit is infused within 4 hours. Types of transfusion reactions. A transfusion reaction is when the recipient's immune system reacts to the donor's blood. We can remember the main signs and symptoms with the mnemonic reaction: rash, elevated temperature by 1.8 degrees Fahrenheit or 1 degree Celsius from baseline, aching back, chest, or head, chills, tachycardia, increased respirations, oliguria, low or no urine output, nausea. Specific transfusion reactions. 1. Hemolytic reaction. This is the most serious reaction. It happens when the patient's immune system attacks the donor's red blood cells because the blood types are incompatible. It can lead to DIC, disseminated intravascular coagulation, and renal failure. Febrile, non-hemolytic reaction. This is the most common reaction. The recipient's white blood cells react with the donor's white blood cells. This is more common in patients with a history of transfusions and presents with fever, chills, and headache. 3. Allergic reaction. This happens when the recipient's immune system reacts to proteins in the donor's blood. Can range from mild hives and itching to severe anaphylaxis with wheezing and swelling. 4. GVHD, graft versus host disease, a rare but deadly reaction where the donor's T lymphocytes attack the recipient's tissues. It can occur days to weeks later. Signs include a peculiar rash on the hands and feet, fever, and GI issues. 5. Circulatory overload. This occurs when blood is given too quickly, overwhelming the heart. Signs include shortness of breath and fluid backup into the lungs. 6. Septicemia. This happens when the blood is contaminated, leading to a systemic infection. What to do if a reaction occurs? If a patient shows any signs of a reaction, remember your nursing interventions. Stop the transfusion immediately. Note the time. Disconnect the blood tubing at the IV site and replace it with a new line. Start infusing normal saline to keep the vein open. Notify the doctor and the blood bank. Stay with the patient and monitor their vital signs every 5 minutes. Expect the doctor to order medications like corticosteroids, antihistamines, or diuretics. Do not discard the blood bag or tubing. You must send it back to the blood bank for testing. Document everything. That wraps up our deep dive into blood transfusions. I hope this helped you feel more confident about this procedure. Now, let's test your knowledge with a quick quiz. NCLEX-style quiz. Question 1. A nurse is preparing to administer a blood transfusion. The patient has a history of multiple blood transfusions in the past. The physician's order includes a pre-transfusion medication. Which medication would the nurse most likely expect to administer? Lisinopril. B. Diphenhydramine Benadryl. Furosemide Lasix. The correct answer is C. Diphenhydramine Benadryl. Rationale. Patients with a history of multiple transfusions are at an increased risk for a febrile non-hemolytic transfusion reaction. Pre-medicating with an antihistamine like diphenhydramine or an antipyretic like acetaminophen helps prevent this reaction. Question 2. The nurse is preparing to hang a unit of packed red blood cells. The most appropriate IV solution to prime the tubing with is a 5% dextrose in water, a normal saline, lactated ringers, 5 for dextrose and 0.45 per saline. The correct answer is B, 0.9% normal saline. Rationale: normal saline is the only solution compatible with blood transfusions. Other solutions can cause the red blood cells to hemolyze or clump together, making them ineffective. Question 3. During the first 15 minutes of a blood transfusion, the patient reports feeling itchy and develops hives. What is the nurse's first and most immediate action? A. Slow the transfusion rate and continue to monitor the patient. B. Administer an antihistamine and continue the transfusion. C. Stop the transfusion immediately and disconnect the blood tubing. D. Call the physician and wait for further orders. The correct answer C. Stop the transfusion immediately and disconnect the blood tubing. Rationale: the patient is experiencing an allergic transfusion reaction. The first priority is to stop the infusion to prevent a more severe reaction. The nurse should then replace the tubing with a new one and run normal saline to maintain IV access, notify the physician and blood bank, and continue monitoring the patient. Great job! Thanks for watching Study Nurse IQ. Follow us on YouTube at Study Nurse IQ, Nursing Made Simple.